All India Radio presents Morning News. Good morning, I am Valsa Williams and with me is Subhadra Ramachandran. The headlines: 532 flights operated on the first day of resumption of domestic flights, Andhra Pradesh to resume flights today. Over 40 lakh migrant workers ferried by railways in 3,060 Shramik special trains. Prime Minister Narendra Modi says India-UAE cooperation has grown even stronger during COVID-19 challenge. India utilized lockdown period to ramp up its healthcare infrastructure, says Health Minister. Uttar Pradesh government to set up Migration Commission to help find jobs for workers returning from different states. Kerala board exams for class 10th and 12th to begin today. And Japan completely lifts nationwide emergency. Civil Aviation Minister Hardeep Singh Puri has said that 532 domestic passenger flights operated in the country yesterday. In a tweet, he informed that 39,231 passengers boarded the flights on the first day of operation. One-third of the total domestic commercial flights in the country flew yesterday after almost 61 days of suspension of their operations as a measure to control spread of infection of COVID-19. Andhra Pradesh is set to resume flight operations from today, while in West Bengal they will resume from Thursday. In Tamil Nadu, 21 flights are scheduled to arrive at Chennai airport from various locations, while 20 flights are set to take off today. On the first day of operations yesterday, the city handled 35 flights. The number of COVID-19 infections in the state has crossed the 17,000 mark with 805 fresh cases yesterday. They include 549 from Chennai and 93 returnees from other states. A report.
The Health Department in Tamil Nadu says it is focusing sharply on 4 areas as part of the disease control measures. They include increased testing for the SARS-CoV-2 virus, early detection of the hidden COVID-19 cases, effective clinical management, and cure and discharge of cases. Preventive efforts also go in parallel with the clinical measures. Meanwhile, a special team of experts in the state are studying the past epidemiological data and are making the projections on the possible scenario in the next 3 months. As most of the victims of the pandemic are aged more than 60 years, age is also being considered as one of the 11 comorbidity conditions relating to the pandemic. Jai Singh, AR News, Chennai.
Railways has operationalized more than 3,060 Shramik special trains across the country to transport migrant workers to their home states. More than 40 lakh passengers have reached their destinations by these trains. Rail Minister Piyush Goyal has expressed happiness that the railways successfully operated more than 3,000 Shramik special trains and took migrant workers from different parts of the country to their home state. In a tweet, Mr. Goyal appealed to all the states to cooperate with the railways and help their labourer brothers. Our correspondent reports that 80% of these Shramik trains are destined for various destinations in Uttar Pradesh and Bihar.
Railways had started running Shramik special trains from 1st of May to move migrant workers, pilgrims, tourists, students and other persons stranded at different places due to lockdown. The top 5 states and union territories from where maximum trains originated are Gujarat, Maharashtra, Punjab, Uttar Pradesh and Delhi. These trains were terminated in various states across the country. Uttar Pradesh received the highest number of 1,245 trains, followed by Bihar 846 trains and Jharkhand 123 trains. During the journey, passengers are given free meals and water. In addition to Shramik Specials, Railways is also running 15 pairs of special AC trains connecting New Delhi and has decided to start 200 more trains from 1st June. With Dipendra Anand Kumar, AIR News, Delhi.
Uttar Pradesh government has decided to set up a migration commission to help find jobs for workers returning home. Additional Chief Secretary Home and Information Avnish Avasthi said any state that wants labourers from UP has to seek its permission.
उस आयोग का नाम है कामगार श्रमिक सेवायोजन एवं रोजगार कल्याण आयोग। आयोग के माध्यम से उनका निर्देश यह है कि सेवायोजन और रोजगार के क्षेत्र में, स्किल मैपिंग के क्षेत्र में, स्किल डेवलपमेंट के क्षेत्र में ऐसे जो श्रमिक और कामगार आए हैं, आवासीय सुविधा जो प्रधानमंत्री जी का पैकेज है उसका सहयोग कराने के लिए, ऐसे जो व्यक्ति आए हैं उनकी अप्रेंटिसशिप करने के समय ट्रेनिंग भी होगी, उनको कुछ मानदेय भी मिलेगा।
Chief Minister Yogi Adityanath also said that other states will need permission from the UP government if they want to make use of labourers from Uttar Pradesh. About 25 lakh migrant workers and their families have returned to Uttar Pradesh from other states. At a meeting with senior officials, Chief Minister reiterated that his government is committed to a safe and respectable homecoming of workers and to providing them with jobs and social security. The planned commission will look into workers' rights, prevent their exploitation and provide an official framework to ensure socio-economic and legal support for them. Chief Minister said insurance, social security, re-employment assistance, provision for unemployment allowance are some of the factors that will be looked into by the Commission.
The second plus phase of Vande Bharat mission to bring home Indian nationals stranded abroad will start today. Around 140 flights from Gulf countries have been added in this phase of the mission. These flights are expected to fly back more than 23,000 Indians stranded abroad. More destinations may be added in due course in coordination with the state governments. This phase will continue till the 8th of June. Maximum number of flights are scheduled from the UAE. A list of 57 flights have been declared as of now from Dubai and another 26 flights from Abu Dhabi. 8 flights will be operated from the UAE today, which will bring back more than 1,300 passengers. 14 flights from Saudi Arabia, 15 from Oman, 10 from Qatar, 12 from Kuwait, and 5 from Bahrain are scheduled in this phase. A majority of the flights from the Gulf are for Kerala. Other destinations include Jaipur, Gaya, Chandigarh, Ahmedabad, Kolkata, Srinagar, Goa, Chennai, Madurai, Lucknow, Karnataka, Delhi, Amritsar, Hyderabad, Coimbatore and Bengaluru. More from our correspondent.
More flights have been added in this phase of the Vande Bharat mission to evacuate more stranded and distressed overseas Indian nationals. This phase is commencing from today. From the Gulf countries, approximately 140 flights have been scheduled, which is likely to benefit more than 23,000 Indians. More than 80 flights under the Vande Bharat has been scheduled from the UAE over the next 2 weeks. Today, there are 8 flights scheduled from the UAE, 4 from Dubai and 4 from Abu Dhabi. More than 1,300 Indians are expected to go back to the country today. The Indian mission in the UAE tweeted that many new destinations have been added in this phase and more destinations are likely to be added in the due course in coordination with the state government. Kanchan Prasad, AIR News, Dubai.
The Vande Bharat mission is one of the largest and most complex evacuation exercises by the government to bring home Indian nationals stranded abroad. Health Minister Harshvardhan has said that India utilized the lockdown period to ramp up its healthcare infrastructure. He said the lockdown also helped to keep its COVID-19 mortality rates relatively low. Dr. Harshvardhan said central and state governments have put in place 3,027 dedicated COVID-19 hospitals and COVID health centers besides 7,013 COVID care centers. He said all dedicated health facilities together have 2.81 lakh isolation beds, 31,250 intensive care unit beds and 11,387 beds with oxygen support for patients. He said India has managed to put up a better fight against COVID-19 as compared to many other developed and developing countries.
डेडिकेटेड अस्पताल 2.5 लाख के करीब बेड्स हैं आइसोलेशन प्लस आईसीयू के। लगभग 2065 हमने कोविड के एक्सक्लूसिवली डेडिकेटेड जो है हेल्थ सेंटर्स देश में क्रिएट किए। इनमें भी लगभग हमारे 1,77,000 जो है बेड्स इन अस्पतालों के अंदर जो है हमारे ये मरीजों का इंतजाम है। फिर हमने कोविड केयर सेंटर्स जो कि मामूली जो सिम्टम्स वाले पेशेंट्स हैं उनके लिए ऐसे भी लगभग देश में 7,063 हमने कोविड केयर सेंटर्स को विकसित किया, जिसमें करीब 6.5 लाख बेड्स की व्यवस्था की।
Delhi government has directed private hospitals and nursing homes with a capacity of 50 beds or more to reserve 20% of their total bed strength for COVID-19 patients. In a tweet, Delhi Health Minister Satyendra Jain said the Delhi government felt an imperative need to increase the number of beds dedicated to COVID-19 patients. He said 117 private hospitals and nursing homes have been directed to reserve 20% of their total bed strength for COVID-19 patients. An order issued by the Delhi government said it has been found that in the recent past, the majority of beds earmarked for COVID-19 patients in the dedicated private hospitals are occupied at any given time. Therefore, there is a need to increase the number of beds dedicated for COVID-19 patients in private hospitals in the city. Multiple COVID-19 treatment hospitals and centers with a combined capacity of 7,000 beds will come up in Mumbai in the next 2 weeks. Maharashtra Chief Minister Uddhav Thackeray's office said these hospitals and centers will come up at Mahalakshmi Racecourse, Goregaon, Dahisar and Mulund in the suburbs. Meanwhile, State Cabinet Minister and senior Congress leader Ashok Chavan, who has tested positive for coronavirus, was on Monday admitted in a hospital in Mumbai. He became the second Cabinet Minister after NCP leader Jitendra Awad to test positive for coronavirus. More from our correspondent.
The Chief Minister's office said by May 31st, Mumbai city's bed capacity will be increased by 2,475, including a facility at Bandra East, which has commenced operations. The state government has started taking over non-public hospitals having at least 100 beds and 20 ICU beds in all wards of the BMC to convert them into COVID-19 care centers. The number of ambulances is also being increased from 100 now to 450. The state reported 2,436 new COVID-19 cases and 60 deaths in last 24 hours, taking the overall case count to 52,667 and the number of fatalities to 1,695. Sonali Ghadiyal Patil, AIR News, Mumbai.
Minister for Micro, Small and Medium Enterprises Nitin Gadkari has said the government is exploring new financial lending institutions to support small-scale units in terms of financial support. He said the government is working towards strengthening the non-banking financial companies, which will help small businesses to avail easy credit in the coming time. Addressing the members of the Calcutta Chamber of Commerce on the impact of COVID-19 on MSMEs through video conference, Mr. Gadkari requested all the stakeholders to work in tandem and urged the industry to maintain a positive attitude during this time to tide over the crisis.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. 532 flights operated on the first day of resumption of domestic flights. Andhra Pradesh to resume flights today. Over 40 lakh migrant workers ferried by railways in 3,060 Shramik special trains. Prime Minister Narendra Modi says India-UAE cooperation has grown even stronger during COVID-19 challenge. India utilized lockdown period to ramp up its healthcare infrastructure, says Health Minister. Uttar Pradesh government to set up Migration Commission to help find jobs for workers returning from different states. Kerala board exams for class 10 and 12 to begin today, and Japan completely lifts nationwide emergency. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Kerala board exams for the class 10th and 12th, which had been postponed due to COVID-19 lockdown, will be held from today. Special measures are being taken for the safety of students and teachers since the exams are taking place amidst the coronavirus pandemic. More from our correspondent.
The exams are scheduled to be held from today till May 31st. The Class 12 exams will be held in the forenoon and the 10th and Plus 1 exams will be held in the afternoon. Elaborate arrangements are being done by the state government in coordination with the State Education Department and Health Department for the smooth conduct of exams, ensuring proper COVID protocols are being followed. Special transport facility are being provided for children to reach centers. All exam centers are properly disinfected. Masks and sanitizers are distributed to all in the premises. Students coming from containment zones and whose family are in quarantine will be seated separately. Strict social distancing will be followed in all exam halls. No shops are permitted near exam halls to avoid crowding. Over 9 lakh students will be taking the exams in Kerala today. Mayusha for AIR News from Thiruvananthapuram.
In view of increasing cases of COVID-19, the Himachal Pradesh government has decided to authorize district magistrates to extend curfew to the 30th of June if required. At present, the curfew is enforced till the 31st of May, and thereafter district magistrates will decide about it. Our correspondent reports that the Himachal Pradesh government had imposed curfew in the entire state from March the 24th.
In view of the growing number of coronavirus cases, the state government has decided to authorize district magistrates to extend curfew till 30 June if the situation so requires. Notification in this regard has been issued separately for each district by the governor. The district magistrates of Hamirpur and Solan have issued orders extending the curfew in their areas up to June 30. Meanwhile, death toll due to COVID-19 has increased to 5 in the state. The total number of COVID-19 cases in Himachal Pradesh surged to 223. Of these, 151 are active cases. Hamirpur district has the highest number of 56 cases, followed by Kangra with 42 cases. However, 63 COVID-19 patients have also been cured in this state. Sanjeev Sundaryal, AIR News, Shimla.
Coronavirus cases continue to surge in Bihar, with 163 more people testing positive for COVID-19, taking the statewide tally to 2,737. A total of 63,741 samples have been tested and 729 people have recovered so far. The virus claimed 13 lives and 1,994 patients are undergoing in different hospitals. Arrival of migrant contributes to rise in total cases. Positive cases were detected in 2,809 migrant workers. COVID cases doubled in 10 days in the state. In Tripura, 4 persons who have returned from Maharashtra by a special train tested positive for the novel coronavirus yesterday. With this, the number of COVID-19 positive cases in the state stands 198. Officials said altogether samples of 990 people were tested yesterday, of which 4 persons were found positive. Earlier on Sunday, 3 persons who had returned from Delhi were tested positive for the virus. As many as 165 patients were discharged from the hospital after recovery yesterday.
In Gujarat, the total number of COVID-19 cases has reached 14,468 after 405 fresh cases were reported from 20 districts yesterday. The State Health Department said 224 people were discharged yesterday after full recovery. The state reported 30 deaths due to COVID-19 yesterday, after which the total death toll rose to 888. Among the total active cases in the state, 109 patients are critical who are on ventilator system. Meanwhile, over nearly 680,000 workers are employed in more than 29,000 development works under the Manrega scheme across the state amid the lockdown. A report.
Secretary to Chief Minister Ashwini Kumar said at present Manrega works are underway in more than 6,500 villages across the state. The tribal dominant Dahod district is on the top in giving employment to nearly 1,06,000 people under Manrega. Similarly, over 18 lakh workers gained employment under the third phase of state Sujalam Suflam Jal Sanjay Yojana. The scheme is meant to increase the water holding capacity ahead of monsoon. The third phase of the Sujalam Suflam Jal Sanchay Abhiyan was initiated from April 28 and will conclude on June 10th. More than 5,600 works are under progress across the state. Aparna Khun, AIR News, Ahmedabad.
In Madhya Pradesh, 194 new cases were reported during the last 24 hours. As a result, the number of people infected with coronavirus has gone up to 6,859. The death toll has also increased to 300. 3,571 people have recovered. We have more from our correspondent.
More than 1,38,000 tests have been conducted in Madhya Pradesh so far, and the percentage of positive cases is 4.96 compared to the total number of tests. Meanwhile, general promotion will not be given to the college and university students in Madhya Pradesh. The state government has decided to conduct examinations for the college and the university students and start a new academic session from October 1st. All college level examinations will be held between June 29 to July 31st, and the result will be declared by August. On the other hand, keeping in mind the health of police staff, the state government had decided that the police personnel from constable to inspector level will be allowed to wear blue cotton sports cap in place of beret cap in special situations like pandemic and relief work. Sanjeev Sharma, AIR News, Bhopal.
In Rajasthan, the number of COVID-19 cases has gone up to 7,300, out of which 1,844 persons are migrants who recently returned from other states. 272 persons tested positive for COVID-19 yesterday. 4,056 people have recovered so far. State government issued orders yesterday allowing some more activities. Our correspondent has filed this report.
The State Home Department issued an order late last night allowing limited operation of taxis and auto rickshaws in the red zone with certain conditions. These vehicles will be operated only from airports, railway stations and hospitals, for which prior approval will be required from the Traffic Department. Additional Chief Secretary of Home Department Rajiv Swarup told that 2 passengers in a taxi and 1 passenger in an auto rickshaw will be permitted to travel. Shri Swarup clarified that persons selling food items on handcarts, kiosks and small shops have already been permitted. Meanwhile, 19 flights were operated from Jaipur Airport yesterday, in which more than 1,100 passengers travelled. Jitendra Dwivedi, AIR News, Jaipur.
Authorities in Jammu and Kashmir have taken a slew of welfare measures to benefit common man in the Union Territory. Government spokesperson Rohit Kansal said these welfare measures proved effective during lockdown to mitigate the suffering of people. More from our correspondent.
Jammu and Kashmir Union Territory has become number 1 in the country for conducting maximum tests per day for coronavirus pandemic. The testing capacity in the Union Territory has gone up from just 100 tests per day in March to present 8,000 tests per day. In the previous month, tests in Jammu and Kashmir has gone up from 1,800 tests per day to 8,100 tests, which is an increase of 350% as far as percentage of tests in Jammu and Kashmir is concerned. Meanwhile, 47 new cases of COVID-19 were reported yesterday in Jammu and Kashmir, out of which 33 were reported from Jammu and 14 from Kashmir region, taking the total number of cases to 1,668. 2 fatalities, 1 each in Jammu and Kashmir regions were reported yesterday, taking the death toll due to pandemic in Jammu and Kashmir to 23. Sunil Kohl for AR News from Srinagar.
Prime Minister Narendra Modi had a telephonic conversation with Crown Prince of Abu Dhabi, Sheikh Mohammed bin Zayed Al Nahyan yesterday and conveyed greetings on Eid al-Fitr to the government and the people of the UAE. During the conversation, both leaders expressed satisfaction about the effective cooperation between the two countries during the COVID-19 pandemic situation. The Prime Minister said India-UAE cooperation has grown even stronger during the COVID-19 challenge. Mr. Modi thanked the Crown Prince for the support extended to Indian citizens in the UAE. The Prime Minister also conveyed his best wishes for the good health and well-being of the Crown Prince, the royal family and the people of the UAE. India and Israel will be working together to develop a rapid testing module for coronavirus. The proposed testing system will be based on artificial intelligence and big data technology. The rapid testing module aims at establishing larger normalcy and will help people restart routine activities. A high-level meeting for scientific cooperation between both the countries was held on Sunday and was attended by Principal Scientific Advisor K. Vijay Raghavan and other senior representatives from the Council of Scientific and Industrial Research, Defence Research and Development Organization and National Centre for Biological Sciences. Senior representatives from Israel's Defence Research and Development Directorate were also present during the meeting. Prime Minister Narendra Modi has spoken twice to his Israeli counterpart Benjamin Netanyahu since the WHO declared COVID-19 a world pandemic. Israeli embassy in New Delhi has termed this joint effort as part of the vision shared by both the countries for a wide range of scientific cooperation.
Japan has completely lifted nationwide emergency imposed following coronavirus pandemic. Japanese Prime Minister Shinzo Abe announced yesterday that the emergency will be lifted in the remaining 5 prefectures, including Tokyo. He warned that the state of emergency can be reimposed if the infection starts spreading rapidly again. Mr. Abe said expert commission established by the Japanese government at the beginning of the outbreak will present by mid-June guidelines for clubs, bars and karaoke spots where several COVID-19 clusters have originated. Japanese government had declared the state of emergency for Tokyo and 6 neighboring prefectures in early April and later expanded it to cover the entire country. In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Sanjay Pandey of GB Pant Hospital, Delhi said that the symptoms of the coronavirus are upper respiratory tract infection, sneezing and cough.
आम फ्लू और कोरोना वायरस के जो सिम्टम है, दोनों के सिम्टम मिलते जुलते हैं, जैसे खांसी आना, बुखार होना, नाक बहना। और कोरोना वायरस के 10 से 15% पेशेंट ऐसे हैं जिनमें कई बार सांस की दिक्कत हो जाती है। इनकी संख्या कम है, 10 से 15%। अगर कोई वृद्ध वयस्क हो या कोई इस तरह की बीमारी पहले से हो, जैसे ब्लड प्रेशर, डायबिटीज, तो उनका विशेष रूप से ख्याल रखें।
Talking to AIR News, President of Indian Medical Association, Dr. Rajan Sharma, said that citizens need to follow basic hygiene and social distancing norms.
Post-lockdown, when we are seeing these things opening up, please learn to respect these things, follow rules, be honest, law-abiding citizens. For a population of 130 crores, you cannot have so many policemen and so many doctors and nurses and healthcare professionals to treat you. Please observe isolation in case of any problem, consult your doctor and be truthful to your doctor.
Talking to All India Radio News in a special program on COVID-19, senior medical expert Dr. A.K. Varshane from RML Hospital advised people to immediately consult a doctor if they have any symptoms.
अगर कोई व्यक्ति जो आपके संपर्क में है या जान पहचान में है, जिसको आप देख रहे हैं कि बुखार हो रहा है या खांसी हो रहा है, उसको तुरंत ही कहें कि भाई आप अपने को आइसोलेट कर लीजिए। तुरंत ही नजदीकी स्वास्थ्य केंद्र पे जाके अपनी जांच कराइए। सरकार ने हेल्पलाइन नंबर दिए हैं, आप उनको कांटेक्ट कर सकते हैं। आपको बताएंगे कि आपका एरिया में कौन सा हॉस्पिटल है जिसमें आप अपनी जांच करा सकते हैं। अगर उस जांच में आप पॉजिटिव आते हैं तो फिर उसके हिसाब से आपको आइसोलेट होना पड़ेगा और जो भी उचित उपचार होगा वो अस्पताल वाले बताएंगे।
Talking about the vaccine, he said that it will enhance the body's capability to develop antibodies at a faster rate.
अगर हमारे पास कोई वैक्सीन आ जाए तो जब वो वैक्सीन का टीका पहले लगा देंगे तो उसके शरीर में पहले से इम्यूनिटी होगी। अगर वायरस आता भी है तो उसको नुकसान नहीं कर पाएगा, वो उससे बच जाएगा। नॉर्मल जब इन्फेक्शन होता है, जैसे इस समय अभी आपको इन्फेक्शन हो रहा है, अभी भी हमारा शरीर एंटीबॉडी बनाएगा, लेकिन इस एंटीबॉडी बनाने में उसको हफ्ते से 2 हफ्ते लग जाते हैं। तब तक वो वायरस हमारे शरीर में एक्टिव रहता है और हफ्ते 2 हफ्ते के बाद वो जो एंटीबॉडी है उस वायरस को किल कर देती है। तो ये जो ठीक हो रहा है वो उसकी बॉडी जो एंटीबॉडी बना रही है उसे ठीक हो।
Veteran actor Akshay Kumar has appealed to people to stay at home and follow all guidelines regarding the lockdown to save themselves and their families from coronavirus.
घर पर हूँ, उम्मीद करता हूँ कि आप भी मुझे घर बैठ के देख रहे होंगे और अगर आप बाहर हैं तो किसी बहुत बहुत जरूरी काम से होंगे, क्योंकि अभी हम सब का खुद से ये सवाल पूछना बहुत जरूरी है कि क्या मेरा बाहर जाना जरूरी है, क्या मेरा बाहर जाना सुरक्षित है। कोरोना वायरस छुट्टी पर नहीं, काफी जोर शोर से काम कर रहा है, ओवर टाइम कर रहा है। इस रेस में वो आगे चल रहा है, लेकिन रेस अभी बाकी है, जीता नहीं है। हम जीत सकते हैं, हमें जीतना ही होगा।
The BJP will hold virtual rallies across the country and organize over 1,000 conferences online as it readies to celebrate the first anniversary of the Narendra Modi government's second term. In a communication to state units and other senior office bearers, BJP General Secretary Arun Singh said all big state units will hold at least 2 virtual rallies and smaller units will hold 1, adding that over 750 people should attend each of these programs. The events organized by the party to mark the day will begin on the 30th of this month.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Listeners can ask questions to the experts on toll-free telephone numbers 1-800-115-767. Repeat, 1-800-115-767. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards.
Now let us take a look at the weather forecast for today. There will be a heat wave in New Delhi today. The national capital will witness minimum temperature of 28 degrees Celsius and maximum 46 degrees Celsius. In Gilgit in the north, the temperature will hover between 13 and 34 degrees Celsius. In Muzaffarabad, there will be mainly clear sky becoming partly cloudy towards afternoon or evening.
Now, an overview of today's newspapers. Domestic flights resume in India is the lead in the Statesman. 532 flights take off on day 1. Non-metro see highest demand. Delhi Patna most bookings, headlines the Indian Express. The Pioneer cites the Supreme Court telling Air India to keep middle seats vacant after June 6. Testing up in states seeing massive return of migrants is a front page focus in the Hindu. Delhi CM says home isolation key focus area as cases crossed 14,000 notes, the Hindustan Times. The Indian Express states, in Delhi, the share of private COVID beds occupied is double that in government hospitals. WHO suspends HCQ trial over safety concerns, reports the Times of India. And finally, virus may undo gains of war on plastic, notes the Statesman, as masks, gloves and gowns used on the front lines of the war against COVID-19 to food delivered in disposable plastic containers find their way back into daily life.
And now, before we end the bulletin, the headlines once again. 532 flights operated on first day of resumption of domestic flights. Andhra Pradesh to resume flights today. Over 40 lakh migrant workers ferried by railways in 3,060 Shramik special trains. India utilized lockdown period to ramp up its healthcare infrastructure, says Health Minister. Uttar Pradesh government to set up Migration Commission to help find jobs for workers returning from different states. Kerala board exams for class 10th and 12th to begin today. And with that, we end the morning news. Have a nice day.